Welcome, members, friends, and new listeners to the Global Justice Report, a new online production of the Center for Global Justice. I'm Cliff Durand, your host for today's program. We opened with the Cuban national anthem. That's because we are celebrating one of the signal accomplishments of the Cuban Revolution, the building of a robust health care system. Excuse me, do you hear that music?
No.
I
You
do.
shouldn't be.
Oh.
I'm sorry. Okay. Um, yeah, it is the accomplishments of the Cuban Revolution, particularly in building a robust healthcare system that is the envy of the world, particularly in this time of the COVID pandemic. The Center for Global Justice is a multinational and bilingual research center in San Miguel de Allende, Mexico. The center is devoted to research and learning for a better world. Since 2004, we've offered educational programs in English for expats and visitors, and programs in Spanish for the Mexican community. We've also organized educational travel to Chiapas and to Cuba. Our vision is to move control of economic life and relations with Mother Earth from the 1% to the 99%. Coronavirus has set in relief the failures of neoliberal capitalism. Our weekly Global Justice Report will explore various grassroots democratic solutions, including self-management, cooperatives, mutual aid, and public banking. If you have suggestions for future webinars, type them into the chat box. That's also where you can type your questions for today's speakers. We'll have a question and answer session following the presentations. So just type your questions in the chat box. You can find it on the right side of your screen. Yesterday marked the 67th anniversary of the start of the Cuban Revolution on July 26, 1953. Since its triumph on January 1st, 1959, Cuba has prioritized the development of its human resources. As a result, it now has more doctors per capita than any other country, 9 doctors per 1,000 population. The US has 2.6 doctors per 1,000, less than a third. And Cuba has a system of universal free preventative health care. This has enabled it to come through the pandemic with the lowest infection rate and lowest mortality rate in the hemisphere. And Cuba shares its human wealth with others, having sent over 3,000 health workers to help combat COVID-19 in over 30 countries, including Mexico. Cuba's doctors are now being proposed for a Nobel Peace Prize. Well, this remarkable effort will be discussed by the Cuban ambassador to the United States, Jose Ramon Cabanas. He will be joined by Victor Wallis, author, scholar, and activist, as well as economist Al Campbell. Let me introduce each of them briefly. Victor Wallis has been long-time managing editor of the journal Socialism and Democracy. His latest book is Red-Green Revolution, the Politics and Technology of Eco-Socialism. He's also published Democracy Denied and Socialist Practice, Histories and Theories. Many years ago, Victor went to Cuba with me for a conference at the University of Havana. It's good to see you again, Victor.
You, Cliff.
For many years, Al Campbell worked with me on the Conference of Cuban and North American Philosophers and Social Scientists, held annually at the University of Havana. Since retiring from the University of Utah, he moved to Switzerland, but continues to visit Cuba frequently, maintaining contact with Cuban scholars. In 2013, he edited a volume by them on Cuban economists on the Cuban economy. I'm glad to be with you again, too, Al.
Yeah, good to see you.
We are honored to have as our main speaker today Cuba's ambassador to the United States. Jose Ramon Cabanas has been based in Washington, D.C. for 8 years now, and in 2015, with the normalization of relations between our two countries, he then officially became ambassador. Prior to that, he's enjoyed a number of diplomatic postings in Austria and Canada, as well as responsibilities in Cuba in the foreign ministry. So without any further introduction, let me hand the floor over to Jose Ramon. And it is with a great pleasure that we welcome you to this webinar. The floor is yours.
Thank you, Cliff. Thank you for organizing this webinar. I thank the center, of course, Victor and Al to be present and to exchange some ideas with us. My regards to your audience. Certainly, you have many people following this subject, and it's an opportunity for us to share what we have done in Cuba, what we are doing, and not only local in our country, but also helping others. As you said, in 35 countries so far. Not only countries, but as you know, we have a few brigades in so-called overseas territories. I mean, in the Caribbean, British and French territories, but I will refer to that later on. Well, we were invited to talk and to explain a little bit how the Cuban system for health is structured, how it works, the principles that we have followed. You mentioned two important anniversaries in our history. I mean, the July the 26th, 1953, and the triumph of the Cuban Revolution in January 1st, 59. Well, one of the reasons that the revolution was fought was precisely to change the status quo in Cuba about public health. Many years ago, I mean 6 years ago, when our life expectancy was roughly 60 years old, when we have 2 or 3 main hospitals in Cuba, when we had just 2 faculties of medicine in the country, and not a global coverage for our population. We fought the revolution to have health and public health as a human right, as it is recognized in our current constitution, to have a free and universal service to the whole population. And it's important to understand that our current health system is based, when you mention a health system, you think probably first about hospitals, about physicians and nurses that work there. But in our case, first we want to think and to talk about the principles that support that system. I mentioned it as a human right. It's a system where all life matter. I mean, we deal with the whole population. We believe that is a governmental responsibility. I mean, the government, the national, provincial, and municipalities, they are not isolated from that service. In the contrary, it's a system where there is an important role played by the population, and after receiving an important education on the matter, where the communities definitely involved, it's impossible to have a health campaign and to have a comprehensive service for 11 million people when communities are not involved. We bet, and we certainly believe in preventive medicine. It's not about people going to hospitals, but hospital going after people. And I was saying before that myself, I don't need to see my doctor in Cuba only when I'm sick. Actually, the family doctor visits me when I'm very healthy, because that's the core of preventive medicine. You have to track diseases, and you have to track the well-being of the family to prevent and gather information about the background, ancestors' diseases, in order to foresee what kind of diseases they can develop into the future. And we can talk about that. One of the later on, among the many projects we have carried out is a genetic map. I mean, we created a genetic map for the whole country, 11 million people, providing us the possibility to foresee the diseases that people will develop in every province, in every municipality. And we can talk about that later on. Our system is based in a very strong Cuban School of Medicine. And when I talk about that, I'm not referring one particular university. I mean the principles of that school and how our people and foreign people studying medicine in Cuba are educated to play that role. Full solidarity with those in need, not only in Cuba and the people covered by our system of social projects, but people abroad. And there is a long history about Cuban cooperation with other countries that started simply a few months after the Cuban Revolution. The first medical brigade was sent abroad back in 1960. And it's important, it's not a principle, but part of that system. We mentioned the hospital, the physicians. I will provide you some numbers to. And you were saying before, we have 9 doctors every 1,000 inhabitants, which means 1 doctor every 116 inhabitants. And I can give figures about hospitals and clinics, but it's important as part of that system to have a national industry to support with services and products and to complement, and not only import products and vaccines and everything and pills, because you have a lot of countries that are fully dependent on imports to complement and to sustain that system. In Cuba, it's the other way around. I mean, we have a national industry that it has been, and under this pandemic, is a fundamental factor to reverse the situation. To give you an idea, but with some figures about our system and the different layers. The only thing in the Cuban system of health is important to understand the many layers we have. Of course, we have hospitals and clinics as any country could have, but the way they are structured from the national level to the provincial level and to the grassroots level. In total, we have in Cuba 284 hospitals. 5 of them are considered national hospitals because they kind of, let's say, Hospital Pedro Curie is called internationally IPK for tropical diseases. It's a national hospital. Like that, we have 5, but in total, we have 284 hospitals. We have 436 community clinics, and it's important to remain that those figures are related to the population of 11 million people, not more than that. We have 166 entomological clinics, 227 maternal homes, and 197 elderly homes. In total, we have roughly 30,000 family doctors. And the family doctor, as you know, is a very important element of the system because it's that person that simply lives with the community. In many countries, to see a doctor, you have to travel probably 100 miles to visit one particular guy at his home or at the hospital. In Cuba, the family doctor is part of the community. It's a few yards from your home, probably in many cases 2-3 blocks, and you have, I would say, a first respondent, someone who is there, not only to deal with emergency, but someone that follows the performance of your family in terms of health, and has a lot of information about the probably one generation, two generations behind you. And the system is supported, as I said, on the after the family doctors, you have the clinics, the neighborhoods, the community clinics, and then you have the hospitals. In a population of 11 million people, with a labor force of 4.5 million, we have more than 400,000 people linked in one way or the other to the health system. You can imagine that. I mean, 1/10 of the labor force in Cuba is related in one way to the other, from being a physician to a nurse, but up to the maintenance guy at the hospital is related to that sector. In the nursing sector, I mean, the nurses and people related with that activity, we have 84,000, which is roughly 122. One nurse every 122 inhabitants. And we have technicians, people that play different roles in that system, 5,400,000. Those are numbers to give you an idea in terms of the labor force, in terms of the institutions that relate to that service. And we are asked often in terms of budget, because of course you need a lot of money to support that activity. Well, 27.5% of our national budget is related to health or social services, which are integrated. It's a lot of money in our economy that is, and if you consider on top of that education, it will be close to half, 50% of your national budget dedicated to those activities. In terms of education, the Cuban School of Medicine, we had 32 higher education institutions related to health. You have from medicine universities just devoted to medicine, as we have in Havana, as we have in Santiago, up to faculties. For instance, in a place so underdeveloped before the revolution, like Siena Zapata or Zapata Swamp, where Bay of Pigs is located, very poor part of our country. Well, over there we have a faculty of medicine. In a very remote place in Cuba, we have those faculties. But in general, we talk about 32 higher education institutions related to that. And we have several centers for research associated to those universities. And finally, I would say, by the standards of third world countries, a very robust industry to produce and to accompany that service, to produce vaccines and other products related to health, now under the umbrella of a holding called BioCuba Pharma. And afterwards, we can probably mention a few vaccines and products that are used generally to support the system in Cuba, but particularly to face the pandemic. Just to mention two other figures that can give you an idea of how our system has worked. We have currently a life expectancy of 80 years for a woman. I mean, if you are a Cuban woman, you have an expectancy of life of 80 years. And for men, 76. And I said before that at the moment of the Cuban Revolution, I mean, in 59, the life expectancy in Cuba was roughly 60 years. The mortality rate in Cuba last year was 5.0%, I mean 5%, no, sorry, 5 every 1,000 born child. And the previous year was 4. And that was a little increase. But in 2018 was the lowest rate in history in Cuba, 4.0%. Cliff mentioned we have currently, I mean, when we talk about the kind of work we do outside, before the COVID, we had already medical presence in 61 countries, roughly 29,000 experts, not only physicians, but nurses and technicians and other people. And during the COVID, so far, and I have to say so far, because we are receiving requests from many countries. We have sent abroad brigades, more than 40 brigades to 35 countries and overseas territories. In that category, we have the British Virgin Islands, Montserrat, Martinique, and Turks and Caicos. We have, as we speak, we have people over there. You mentioned Mexico, as the center is located in Mexico. In Mexico, we had for roughly 3 months, 3 different groups who completed their work and returned to Cuba already. I have to say that some of those brigades, most of them, go to those countries to deal directly with the population that is positive on COVID. In other cases, they have traveled as advisors. I mean, to explain local authorities and local experts how do we deal with the pandemic in Cuba, the way we structure the service, but they don't work directly with the patients, and they don't go directly to hospitals. There is always questions about, well, those diseases that provoke more death in Cuba. I have to say that after 60 years, Cubans died probably from the same diseases that first world countries do. I mean, our first diseases are related with heart issues, cancer, brain diseases, and pneumonia, and then accidents. I mean, as I said before, Cubans live longer, and they live a healthier life, and the system is in a capacity to provide universal coverage for everybody. A question: why Cuba has been successful so far dealing with COVID? Well, we have to say that we didn't create a system to fight COVID. It's the same system that we have to fight any health issues in Cuba that was in place, and we didn't need to build any new facility or things like that. We simply put in place. I mean, we use what we have in place to fight any other disease. Doing prevention, I have witnessed a debate in the United States, because I'm located here, for 4 months, about using the mask, about social distancing, about tracing cases. I have to say that we did that from the very beginning. We received a lot of criticism. Many people are asking if that was a good thing to do, but now people understand that was the right thing to do. In many cases, we had to isolate people not only at home, but in hospitals. We had to impose a quarantine As you know, we cut international flights, but even in those cases, when we have nationals returning to the country, we impose a quarantine of 14 days. They were isolated, they had medical care, and we followed simply the systems. Once they were positive, passing the test, we realized that they were positive, where they were taken to those hospitals when we had the special, system to deal with the disease and to follow the disease. And it was important also to work with just one protocol. Following, I'm not criticizing, simply following what we have seen in the United States. We have seen a debate, a discussion, not only among elected officials, but also among health authorities. And if you talk with people in one hospital, they will tell you that they are working with one protocol, and the hospital next door they are using a different protocol, and if you keep moving, there is a third and a fourth protocol. In Cuba, we have only one protocol to deal with the pandemic that was discussed among the authorities and the experts, but is implemented, and putting a lot of efforts with those cases that we find that they never come to us. I mean, they never come to hospitals because they are the hospitals and the community tracing potential positive cases. Simply studying the symptoms, going door by door, visiting every house to discover who is presenting the symptoms that probably by the end could be a positive case. They are isolated. If they are even those who are not positive still on the disease, then we start to use Cuban products. One of them is, for instance, biomodulina T. I'm saying the name in Spanish. I don't know the translation. Still, it will be probably biomodulin T in Cuba, and it's a product that we have been using for 20 years to fight different diseases because it simply helps to enhance your immune system. Let me tell you, now I'm talking about Cuban products that we never said that we had the solution for COVID, because I have read some articles saying, well, Cubans, they have announced that they have the cure for the disease, that they have the medicine to prevent that. We never said that. No one has still the vaccine. What we can say is that in the process, we are using, as part of our protocols, medicines and injections that we use in a very positive way against other diseases, infectious diseases, tropical diseases, and they are helping the patient not to get serious, not to get in a critical condition, and then remain in a positive situation and never go to ICUs or something like that. If you check our percentage of people moving to critical condition or to serious condition, is half of most of the countries. And as I mentioned before, our lethality rate in COVID is less than half of most of the people. As we speak, we have, today's report, our mortality rate from COVID in Cuba is 3.44, which is less than half of the internationally what you have, is roughly 7 to 8%. In Cuba, during all those months, we had only 2,532 cases in total, 87 deaths. We have been for the last probably 2 weeks without people passing in Cuba from COVID. As we speak, we have only 92 active cases. That figure I mentioned, 2,532 is total, during all these months, but today we have 92 active cases, although we have 269 people in hospital. We are following the symptoms, and we are as I said, helping them not to develop the disease, but in case they do develop the disease, their immune system it will be in better shape. Let me mention just a couple of other products for those people who are already sick, not the ones that are not showing any signal yet, but those who are sick. We are using Everon Alpha 2B human. That's one of the interferons that is calling a lot of attention. That interferon we produce in Cuba for the last 30 years, and we have used it against all diseases with a very positive outcome. And that's this interferon helps you not to go to a critical or to a serious condition. And among those, and if you have questions, we can go deeper on that. That is a product that was called CIGB, respecting the name of the institution that created 258. Now is called popularly as Husbinza. And that product developed in Cuba helps you against the inflammation of your organs. As you know, people becoming in a critical condition in COVID are dying because of that. Well, that product helps you. That was previously used against other diseases, but we discovered in the case of COVID, it is helping people who are in the, I would say, final stages of the disease. And we are working on several others. We have several candidates of a vaccine. We are like many other countries rushing, to find that solution. And another subject that our system is covering is people who recover from COVID. In many countries, you don't have a treatment for those people who already recovered. If you already recovered, that doesn't mean that you are completely healthy afterwards. You still need people following your condition. You still need some treatment for your recovery. Well, we are definitely involved in that part also. And just probably to finish here with the names of products we are mentioning, for those who are in a critical condition, there is a Cuban product, and I will mention the name in Spanish also, is itolizumab. That is calling the attention from not only from experts in Cuba, but experts abroad. As we speak, we have requests from companies in 80 different countries that have been following what we have done in Cuba about COVID, the way we have moved forward, how we have been able so far to manage the situation and to have the infection very, very low. And they understand that these products could be important in their situation, as they have a lot more cases that we do. And they are looking for the Cuban expertise and how to implement that locally. I mean, in general terms, I wanted to give you an overview of our system, how it works, the way it is integrated, why it has worked now against COVID, and what we have been doing trying to help others. During the last week, probably you have seen councils from different cities in the United States passing resolutions looking for this kind of cooperation with Cuba. I have to say that particularly in the United States, we have organized several webinars like a month ago through the magazine Medic. We organized a conversation like this one among Cuban experts and American experts. Remember that back in 2016, we signed an MOU, a bilateral MOU on health, which is a comprehensive one. And it takes into consideration situation like this one we are having with COVID. What I'm trying to say is that American experts, they know very well what we are doing in Cuba. They would like to introduce or to implement the kind of expertise we have developed in Cuba. At the same time, it's important for us to listen from what you have learned in your hospitals and your faculties, and definitely to provide health to humans and to animals and to plants. To have that kind of exchange is important. And my last words would be that from our side, we remain open for that kind of exchange if anyone believes that is useful and important. Thank you.
Well, thank you very much for that overview. And we will be getting to questions. If those of you in the audience have any questions, they will be taken up later after our other two speakers. But take this moment to type them into the chat box so that we'll have them ready. But next we go on to Victor Wallis, who will be giving a presentation on the contrast between the socialist and the capitalist principles governing healthcare. Victor, the floor is yours.
Thank you, Cliff, and thank you for organizing this. And thank you, Jose, for your interesting presentation, and congratulations for the work that Cubans have done on this. Your presentation was very matter of fact, and I guess my role in a way is to underscore the political implications for people, especially in the United States, which represents perhaps the strongest possible contrast in an unfortunately negative way to the practices that you've been describing. But of course, it's a systemic thing that we've known about for a long time. I must mention a book that was very decisive many years ago to my understanding of this, by Vicente Navarro, who's a public health doctor from Spain, who wrote a marvelous short book in the 1970s called "Capitalism is Dangerous to Your Health." And it's, I mean, the facts that he presented there are, in a sense, well enough known to all of us. But I guess the thing that I would want to stress especially is that there's a total systemic issue involved here, which goes all the way up to the natural environment. One of the things Navarro pointed out was that the biggest public health problem was the problem of poverty. And it refers to the fact that in all class divided societies, the greater the inequality, the greater the differences in health indicators, notably summarized especially by life expectancy. And certainly in the United States, the life expectancy of people in the upper income levels is more than 10 years greater than people at the bottom of the economic ladder. And of course, the COVID crisis has simply magnified this because those in the poorer sectors of the economy, and especially people of color, are also the ones who perform the tasks that are most, as they say, essential but expendable, or let's say the tasks are essential, but the people are treated as being expendable. So you have this tremendous irony. But to just go into a little bit more detail about the sense in which capitalism is destructive, and which is again particularly striking in the United States, I would mention, you know, if you look at all the factors that are essential to preserving health, you know, even before you get to the question of healthcare delivery, you have the basic question of public health. And the environmental issue is, of course, fundamental to this. The general destruction of species, the destruction of biodiversity. Of course, this is not peculiar to the United States, but I think what's peculiar in any capitalist country in which there has been little working class influence and therefore few regulations, the restrictions on what can be done for the sake of making profits are minimal. So you have, for example, in the case of diet, you have this extraordinary proliferation of processed foods, excessive amounts of salt, excessive amounts of sugar, all the conditions of basic ill health that flow from that. There was another book that made an impression on me a few years ago by Raj Patel called "Stuffed and Starved." And one of the striking indicators of the ill health that we experience in the United States, perhaps more so than in, I think, any other country except I think Kuwait was one of the other countries that had it, was the incidence of obesity. Because years ago, centuries ago, it was thought that if you were fat, it's because you were prosperous and you ate a lot. Now it's because you're poor and you have poor diet, heavy in starch and without proper nutrients. But so it's the question of diet is certainly something that's affected by the capitalist organization of food production. Of course, just consider all the other basic necessities. Obviously, housing, and housing with a crisis, which again is increasing dramatically at the present time in the United States with the increase in homelessness as real estate prices go up. If you don't have housing, just the basic necessities, if they're not provided to anybody, you don't have an adequate situation. But other features of society, let's say that whose achievement, let's say in a capitalist society, reflects the work of labor unions and working class parties, like the provision of vacations, which are in a way, in the United States is one of the few advanced capitalist countries which, because of its lack of a politically powerful working class, does not have nationally mandated vacation time. And so it's one of the countries in which, among those who are employed, the overwork is excessive. And again, this is directly attributable to the capitalist organization of production, that if you have more work to be done as an employer, it's to your economic advantage not to hire new people, but to make the ones you already have work harder. And plus you have the fact that since there's not an adequate floor level wage, people who can get work often are forced to get more than one job. So the level of stress is absolutely extraordinary. So if you consider all these things, and including the urban pollution and the concentration of respiratory disease like asthma in low-income communities, especially again communities of color, which are placed in the most unhealthy areas, like what they call Cancer Alley in Louisiana, to mention an outstanding example. And the fact that there's so little restriction against all these activities, and it all depends on the market, and people who protest against it are threatened with all kinds of legal action, like the laws that are now being passed trying to declare that people who demonstrate against the construction of oil pipelines to charge them with terrorism. So these are some of the basic problems that exist in capitalist societies, and in the US in particular, I would say, because again, the general idea, when you get to not just to the general conditions of public health, but to healthcare delivery, the general idea that you need to have universal healthcare has become so widely accepted that it's thanks to working class movements and parties in other advanced capitalist countries, it's widely instituted. So the U.S. is a kind of exception in not having it, and it's an odd thing about the way the U.S. labor movement has, in a way, played into this custom, because when the idea of national health care was first being explored in this country in the late 1940s, at that time, the unions that were all modeled on a kind of business unionism principle, seeking really to represent their own particular members as an economic interest rather than a kind of class perspective. They were competing with each other in terms of who could provide the best services to their members. And if they couldn't get raise in wages, they'd get some deal for the companies to pay for the insurance, for the health insurance for their members. So you had this whole idea of tying one's health insurance to one's employment, which now again has collapsed in the most spectacular way in the context of the COVID crisis, where millions of people who lost their jobs automatically with that lost their access to healthcare. So I think that may be a way of mentioning the principal ways in which the capitalist system provides both the problems in the general health of people and the problems in the delivery of healthcare. And so the socialist approach, I don't have to go into great detail about it because I think the Cuban model is of great interest. And again, in our discussion before this this meeting, Jose, you mentioned you don't claim to present Cuba as a model, but I would say nonetheless that it's the best example we can have of an attempt to address the concerns that I've talked about. And obviously, of course, the idea of having personal physicians and spread out and visiting people and knowing people in the condition of health and not just when they get sick is of course basic. But I think there's also a whole moral dimension to this, in the sense that just the sheer emphasis and value that Cuban policy has from the beginning placed upon healthcare, and seeing it as a mission in a way, not only for their own society, but for the world as a whole, is such an embarrassment to the United States. And I mean, to me, it's so shocking to see the way the US is now interfering with the efforts of Cuba to assist other people in other parts of the world with their response to the COVID crisis. It's as though the US government is afraid of the moral example that Cuba presents, a moral, but also a practical example in the fact of actually saving human lives. And so I think, in a way, the health issue presents at the present time on the world scale, amplified by the COVID crisis, this a spectacular example of the clash between basic principles of capitalism and socialism. So that even though any particular attempt at socialism will have all its particular problems, which of course includes Cuba, nonetheless, the idea of placing an emphasis on something as fundamental as the basic health conditions which allow everyone to live a decent life, and which apply them to everyone in the society, and which get away from this tremendous difference that exists in a country like the US between the health of those who have access to healthcare and who also are able to live under more favorable conditions, and all the rest, to show the contrast between an approach such as yours, which respects the needs of everyone worldwide, and including those in the most severe conditions, and one which doesn't, is really a really dramatic, let's say, lesson in wider political significance, that goes beyond that, and should inspire us, and I think does inspire people all over the world, especially now in the present crisis, to recognize the importance of fighting to transform and to escape the constraints that capitalism places on our well-being.
Well, thank you, Victor, for that. Very interesting. Put it in a larger context. You mentioned the book by Vicente Navarro, Capitalism is Dangerous to Your Health. People will be interested to know that we will be having a webinar with Vicente Navarro on the 31st of August. He will be talking precisely on that point. But now we turn the floor over to Al Campbell for the economic dimension of the pandemic. We know in the United States, the pandemic has had a huge impact on the US economy. And so we want to learn what its impact has been in Cuba and how that's been dealt with. Al?
Thanks a lot. I want to throw out some thoughts on the economic impact of COVID on the Cuban economy. I want to stress that I'm not going to try to talk about the Cuban economy in and of itself. One of my credentials that Cliff didn't mention is actually I'm the assistant editor of the International Journal of Cuban Studies out of London. And I mentioned that, besides praising myself, I mentioned that to because the current issue is exactly on the Cuban economy. The contributions are actually all by Cuban economists writing on it. And it's a journal that you ought to follow if you want to know what's going on in Cuba. But here I think I want to try to, in order to be efficient, because I'm an economist, I want to actually follow some prepared comments so I don't wander too much. I'm going to make 6 points in 15 minutes, and then we can pass on to the discussion. The first two are background points on the Cuban economy, points very often misunderstood as a result of the well-known deliberate campaign of misinformation about Cuba in general, and especially buy-in in the United States. These are very simple points, but they're necessary to understand the effects of COVID on the Cuban economy. So background point one. One incorrect presentation of the effects of COVID on the Cuban economy claims that the Cuban economy is always a disaster. It was a disaster before COVID, and so all COVID did was to make Cuba's permanent economic disaster worse. Like many so-called common knowledge facts about Cuba, repeated continuously in much of the international press, the claim is false, as the simplest checking of the data would show, but of course, checking the data isn't part of the story anyways. As most people know, Cuba went through an economically very bad time at the beginning of the 1990s, a collapse of its national income of about the same amount as the Great Depression in the United States, over about the same period of time, over about 4 years. But here's the real picture from the data on the overall performance of the Cuban economy for the quarter of a century since 1995, compared to its Latin American neighbors. Cuba has performed above the average for the region of Latin America and the Caribbean for 22 of those 25 years, and below average for 3 years. Now, this is not a talk about Cuba's economy and what it does well and what things it needs to do better. The only point being made here is that the story of Cuba having a permanently disastrous economic performance as an opening to considering the effects of COVID on the Cuban economy is simply not true. Again, like so many other commonly known facts about the island. The second background economic point is that for any small economy to produce efficiently, which is necessary for a high standard of living, it needs to produce as an integrated component of some larger economy through trade. Only large continental economies like China or India or the United States, or partially Russia or Brazil or Indonesia, could in theory produce at such a large scale that their production could be efficient and sell entirely to its own national markets and get the necessary inputs for each step in the chains of production from its own national markets. If a country the size of Cuba, or even 5 times its size, tries to produce all the products it consumes and all the many steps in the production of each product it consumes, it will produce too little of everything, and it will necessarily be extremely inefficient, causing a low standard of living. Belgium, which has 11 million people, and the Netherlands with 17 million people, can have high levels of efficiency because their exports and imports average 82 and 77% of the gross national product. They are fully integrated parts of an economy that operates at a scale much larger than their population. Even the bigger economies of Germany and France and the United Kingdom need to trade 42 and 29 and 29% of their GDP to be able to produce efficiently to have a high standard of living. They produce as parts of a much larger economy. So we're going to return to this point when we're talking about the effects of COVID on the Cuban economy. Okay, with those two background points, here's 4 brief points on the effects of COVID on the Cuban economy. Actually, I think I'll make that 3 brief points to save time. Point 3. A first very short observation needs to be kept in the front of any discussion about the effects of COVID on the Cuban economy. The effects of COVID are not, in the first instance, like they are on most of the countries in the world, and particularly not like they are on the advanced economies. This is exactly because of what we've just heard from the Cuban ambassador, that Cuba has done such an outstanding job in dealing with COVID as a medical problem. Because of this, the amount of production that Cuba has had to shut down to prevent an explosion of the virus, the amount of consumption spots that it has to close down, et cetera, has been low in comparison to places where the epidemic was allowed to get out of control. Now, to be clear, Cuba does need some of all of this economic closing, again, as the ambassador explained, to avoid the virus from taking hold. but the amount is very different from those countries that need to prevent what's already an epidemic from becoming an even larger health disaster. So again, the point here, COVID will have severe effects on the Cuban economy. And above all, it will do so through Cuba's international economic relations. That is, above all, as a side effect of COVID's effect on the rest of the world. Okay, the fourth point, the effects, get a little bit concrete here, the effects of COVID on the Cuban economy through tourism. As most people expect, it's going to be severe. The starting point here is that when the larger economy that Cuba was integrated into collapsed in 1990, Cuba had to integrate its non-capitalist economy into the world capitalist system for the reasons discussed above. It had to find something that it could export to pay for the imports it needed for the productive activities, as well as the final consumption goods that it did not produce in its role in that larger economy before 1990. And again, remember, producing all the goods it consumes is not an option for any small country if it wants to be able to have a healthy standard of living. Cuba's amazing development of its tourist industry over the course of the 1990s, starting almost from nothing, is pretty well known. In the 1990s, tourism's role in earning convertible currency really made it the engine of the whole economy. But by the first decade of this century, the growth of other industries achieved the healthy result of reducing tourism to being only one of 3 or 4 leading earners of a foreign currency. Nevertheless, it remains extremely important for Cuba's whole economy. In 2018, Cuba needed to import an $11.5 billion of goods in order to make its economy function, as discussed before. It exported less than $2.5 billion of goods. So the needed import of goods were paid for by exporting services. They exported roughly $12 billion in services, covering the deficit in goods and leaving a positive balance on goods and services, which is demanded by the international lenders to Cuba. So tourism earned roughly $3 billion, a full quarter of the country's service export earnings. As is being written about around the world every day, worldwide tourism industry has been devastated. It's very possible its recovery will take several years, and even then it's very possible that it will not reach what it did before COVID. In early July, Cuba announced a 3-step plan to reopen its tourism industry. With many people around the world wishing they could return to pre-COVID times and so thinking about vacations, Cuba, of course, has a big advantage in the very low presence of COVID in the country. Of course, that leaves the problem of how to let tourists in without quarantining them for the duration of their vacation, which is 2 weeks, and simultaneously how to not let COVID loose from these people onto the Cuban population. But in any case, regardless of Cuba's attractiveness from its low COVID rate and its intelligent planning by the government for reopening, it's clear that tourism will be massively impacted. And as we've seen from the numbers, that will be a big issue for the whole Cuban economy. As stated before, even though the effect is a side effect of the level of COVID in the rest of the world, it will have a severe impact on the Cuban economy, in this case, through its effect on tourism. The last point, because I'm going to drop the 6th one, the effects of COVID on the Cuban economy through medical services. What's involved here is an extremely interesting issue about a country trying to build socialism in a capitalist world that it needs to trade with. Because building socialism means being concerned with human development, Cuba for 60 years has put a relatively large part of its government spending into the education and healthcare, again, as the ambassador pointed out with numbers. One result is that people who train to be high quality doctors do so at a vastly lower personal expense than in other countries in the world. And as such, they require a lower salary over the course of their lifetime to compensate for their invested resources. This, of course, is all according to standard economic calculation, ignoring that healthcare is really fundamentally a human service. I'm talking as an economist here. This means that Cuba has what in economics is called a comparative advantage for trading medical services to the world, and it should be extremely successful in selling medical services around the world. And again, I stress, this is not the reason Cuba carries out its medical missions and training around the world, but it is the economics of this service product according to the laws of trade. But the so-called laws of trade, in fact, are always politically constructed and interpreted, not some supposedly objective thing concerning costs of production. The US declares Cuba is cheating on producing at the low cost, since the way Cuba pays for the production of their doctors does not match the way the US does. Note that this is not really a question of government funding for the production of the good. The US is a massive seller of military equipment around the world, and that is a market in the US completely constructed by US government demand. The government is paying for all the production that is consumed in the US, but it's okay somehow for the US to sell all those goods internationally. Okay, we can return to the hypocrisy of the US attack on the Cuban export of medical services, hypocrisy from the position of the supposed capitalist laws of trade in the question period. But here, let me indicate what a big issue this is for the Cuban economy and some of the unknowns about what will happen with COVID. And then after that, we'll stop and go to questions. First, its importance. In 2018, the category of human health and social care services earned $6.4 billion. Using the numbers from the last point on tourism, we can see that this is twice the size of the earnings from tourism, and hence slightly over 50% of Cuba's service export earnings. That is, it's hugely important to the Cuban economy. Now, to start, COVID should increase the demand on the international market for Cuban medical services from the many countries that do not have enough medical people to confront the crisis in their country. And this indeed has happened. But it was met by a very aggressive campaign by the US government to individually threaten every country that was contracting for or considering contracting for these services. Cuba has so far released no figures on what the international missions in the fight against COVID have earned. And Cuba, of course, correctly feels that it cannot release such figures at this time, given the US aggression. But it can be assumed that the earnings would have been significantly higher on the basis of the services being a very good deal if the US had not overridden the so-called normal economic laws with political laws, as it always does whenever it chooses to. As this COVID epidemic is likely to last for several years, and as a change of government in Washington next January from Trump to Biden would likely mean a change from a fanatically aggressive policy to a return to an unfriendly, non-cooperatively, and mildly aggressive policy, the future effects of COVID on earning from Cuba's international medical services are unknown. Okay, let me just end up then with a final paragraph on Cuba. To end, on July 15th, the United Nations Regional Body for Latin America, ECLAC, dramatically increased its estimates of how much Latin America economies would contract from COVID. ECLAC's April estimate of 3.7% contraction for Cuba went up to 8%. This, of course, is a big problem. It's not like the special period, and it needs to be compared with the still larger expected average contraction for Latin America and the Caribbean of 9.1% to be properly understood. But COVID still is, and it will continue to be, a severe blow to the Cuban economy. I guess the one thing I skipped, and I'll just end by ending on it, but not talking about it, is that on the 15th of July, the Council of Ministers and the Minister for the Economy and Planning in a mesa redonda to the Cuban people discussed the plans that they have for going forward. And that's the point that would take another 3 or 4 minutes to go into. So I won't go into that now, but if it were to come up in the questions, I'd probably be able to talk to it. Thank you.
All right. Thank you, Al.
Sure.
Okay, now we're ready to open the floor for discussion, both questions that have come in the chat box, but also discussion among our 3 speakers, if they wish. Let me go to Bob and ask if he has any questions that have appeared in the chat box, and if so, to present them.
We have not received any questions yet, but I have a question for the ambassador, if I may.
Go ahead.
Ambassador, it's an amazing phenomenon that so many young men and women are motivated to serve such a large percentage of your workforce are doctors and nurses and others who are dedicated to serving in Cuba and beyond. This is a phenomenon that is very unusual in the world today. Could you tell what you believe are some of the typical motivations of these young people, and how is it that these motivations are developed in the Cuban people to go to very distant places, to 35 different countries, almost 3,000 workers or more? Could you explain some of those motivations and how they are developed in the Cuban people? Please, thank you, Mr. Ambassador.
Well, thank you for your question, which is a very good one. I think if I quote from Victor now, he put it in the right way. I mean, it's the sense of mission our people have, the way they are educated. And I think that has to do with the Cuban Revolution itself also, but the way our young people are educated in history. We believe, and by the way, the last segment of our fight for independence and freedom was started in 1953, but our wars of independence started in 1868. And since then, we have received the support from many people. I mean, not only countries, but individuals, and especially from the United States. The name of Henry Reeve that the brigades have is a brigadier general, an American guy who came to help the Cuban Mambises to fight against Spain. Then the Cuban Revolution was born with the sentiment that to make it possible, we received the solidarity and support from many people, from many countries and organizations. And after the Cuban Revolution, the blockade was imposed immediately after. And then since then, we again received the support and the solidarity from many people and countries, and mainly from the United States again. Then our youth understand very well the idea and is educated with that knowledge of history, the sense of mission. I mean, if at any time you expect solidarity from anyone, you have to be permanently in solidarity with everyone, and particularly with those in need. I mean, those who don't have the resources, they have, because for the rich and the wealthy, well, they have their own resources, but most of the world, it doesn't. I mean, most of the world needs that kind of solidarity. We are one family. We definitely believe in that, humankind, and we have one boat. I mean, we are on planet Earth. You cannot live from there, although we have dreams to go to the moon or something like that. But if we don't take care of this boat, I mean, this ship, which is the planet Earth, well, it's a problem from everywhere. That's why from the very beginning and during the last 6 years, we have been involved in any cause that we have seen over the world. That's why from the very beginning, our country was so involved in Africa, not only from the military point of view, helping independence in Angola, Namibia, and South Africa, but educating, helping in health. I mean, it's the very essence of building a revolution and unfolding a process like this. And as you mentioned, and probably I missed a point here, we, under the pandemic, we have sent people to 35 different countries and territories, but before the pandemic, we had already physicians and nurses and technicians in 61 other countries before the pandemic. And they added to the brigades that came afterward. And one topic that is usually missed when people talk about the way Cuba has helped is the human capacity that is educated in Cuba from those countries. They are large numbers, and probably the very well-known project is ELAN, the former Latin American School of Medicine that was created back in 1999 by Comandante Jefe Fidel Castro after the Hurricane Mitch impacted Central America. And he was wondering, well, now we can send people there, but when they return, those countries will be on their own. I mean, they will not have local resources to face, and as you know, I mean, future disasters. And as you know, in the Caribbean, we expect 2 to 3 hurricanes every season. Then it's you have to be ready, at least hurricanes, beyond earthquakes or pandemics or something else. Then you have to have your local resources to be resilient and to overcome. And then he was thinking about how to help those guys. Then only at the ELAM, we have more than 30,000 young people graduated in medicine from more than 100 countries. I mean, originally, that school was created to help people from the Americas, I mean, the Western Hemisphere, Latin America, and Caribbean. But at the end, we have students from all over the world, including United States. You have currently roughly 200 physicians graduated in Cuba. We are working in different states in the United States, fighting the pandemic. As we speak, you have roughly 80 students in Cuba, and when they graduate, they will return to the communities in the United States, bringing with them the education we have provided them. When we talk about young people involved in these activities, you have those foreigners studying in Cuba, you have our own experts going abroad. But in the middle of this pandemic, I can tell you frankly, a very important role, I mean, a key role in the way Cuba reacted to the pandemic was the way young people from college, young people from universities, secondary schools, as we had to close those schools, I mean, to quarantine the people, they were voluntary for tracing positive cases, for helping, I mean, following the asymptomatic cases. They were voluntarily to work and to provide some kind of support to those places, to those institutions that remain open during the pandemic. Then it's part of the DNA, it's on their blood, how to get involved and how to help others.
It should be emphasized that those medical missions abroad, Henry Reeve Brigade, etc., are now the reason why there is an effort worldwide to award the Nobel Peace Prize to Cuban doctors this year. There is a website, if anyone wants to sign on in support of that initiative. The website you can go to, cubanobel.org, and you can add your name to a long list of those who are recommending that Cuban doctors be so honored. Victor, Al, either of you have questions or comments you would like to direct to the ambassador or to each other?
Yeah.
Let me comment on one statistic I came across that just sort of blows my mind. Globally, it's something like 80% of COVID patients who reach the critical stage die. 80% who get that far along, that serious, do not survive. In the case of Cuba, though, it's around 25% of those who reach the critical stage who die. Now, that's an amazing statistic, probably due in part to the excellent medical care that patients receive. But I wonder if it isn't also due to the fact that Cuba's preventative healthcare system has created a basically quite healthy population, so that there are fewer people with underlying medical conditions that would make them more vulnerable. Jose Ramon, do you want to comment on that?
Yeah, absolutely. Let me, now that you mentioned those figures, I have, of course, I cannot pretend I'm an expert on biotechnology or things like that, or on this field. But I can, I have, we, on a daily basis, we receive reports from our authorities and the experts that are involved in this, precisely for continue the exchange with the local experts in the United States. And related to that figure you mentioned, I have found two of them here that probably will complement to just what you said. And of course, I will also react to your question. In the world, between 15 to 20% of patients goes to a serious or a critical condition of the disease. In Cuba, it's just 5% of them. And the mortality rates in the world for those patients that use interferon as part of the treatment is 7%. In Cuba, it's less than 1%. And it's a combination of what you just said. The people who get sick in Cuba of COVID, as an average, they are healthier than in other countries. But at the same time, is how the system works and how the protocol works and how the whole machinery around them works. And let me put again an emphasis on working with the asymptomatic cases in doing traceability, I mean, tracing the cases and preparing, I mean, the guy who is positive, as we are following them even before it tests positive on the disease, you help their system, their immune system, to be ready to fight the disease. In Cuba, one death is too much. Imagine 87. But when you review most of them, if not all, are people who had medical preconditions. They suffer from diabetes. They were old people, although you can be old and healthy, but as average age, they were very, very, very old people. In Cuba, we don't have infants dying of COVID, teenagers dying of COVID. I mean, they have from 20 to 30 years old up to, but most of them, and people in the 60s, 70s, and 80s, most of them with medical preconditions. Then, as you said, the basis of the population that potentially could be sick is definitely healthier than in many countries. If they do suffer from diseases like heart, brain diseases, or diabetes, but then they are people who they have the treatment, they meet and they go to the doctor very often. I mean, they have the treatment and they follow and they respect that treatment. If you allow me, because there were a couple of subjects that were mentioned by Al, and I would like in one way or the other to mention them. One of them is the impact of COVID, and we are suffering from the same influences that other countries have. I mean, tourism, I think, is a very important industry for anybody, and other kind of impacts. In Cuba, as you know, we have a different debate because in many countries you have the economy here or the market here, and the life of the population is over here. And my question would be, how in United States, for instance, when you are close to have 150,000 deaths very soon, how you can isolate that from the economy. I mean, it's something different, but going beyond that, what my point is that in our case, any question or any calculation you can do, or we could do about the impact of COVID in Cuba, we have to remember our audience, because you are experts and you know very well, but our audience, that we are still under something that you call embargo in the United States, but we call blockade. I mean, and the impact and the sanctions part of that blockade are not, softer these days. It's the opposite. The United States has been enhancing like never before embargo on Cuba. You have followed some statements from politicians and even members of Congress to relax a little bit and to lessen the consequences of the embargo, but it's the opposite. What it was formerly called an embargo or a blockade, you can call it today a genocide, because when you know that a country like ours, which is a third world country, going through difficult times as a consequence of this pandemic, then to enforce a blockade on such a country is simply an act of genocide. And still, that is a discussion. I mean, after every webinar we attend, then you have people wondering, and these days, legislation will be passed in Congress, and you have, and thank you, Cliff, for mentioning the campaign to award the Henry Reeve Brigade with a Nobel Prize. But these days also in the United States, you have many people active, sending letters and talking to representatives in Congress to change legislation, part of the embargo. I'll mention also something that is a big question mark for every country, I would say, in the world, which is how to conduct responsible tourism in the future. We are probably, this is a new category, I don't know, a new concept. We are opening several facilities all over the country. We have now national tourism. I mean, people who can afford and then go to a remote place, pay for hotels, and they are by thousands, doing that. But we have introduced new regulations in all those facilities to have what you can call responsible tourism. Now, when you open your borders, it's a different ballgame. Depending which are the markets, the people are coming from where, how healthy they are, the kind of test you can implement with them. But no doubt, we believe that if that system that I explained in very general terms has worked for us and have prevented us from going to a more complicated situation, complex situation in terms of COVID, this is a system that will work for the safety of the country at the time of implementing that kind of responsible tourism. But it's definitely a challenge. If we don't have still the vaccine for COVID, I don't think that we have the vaccine for responsible tourism. But it's important in that scenario that countries talk to each other and the good expertise is implemented. I mean, we share the knowledge and we implement the best options we have. Thank you.
Well, let me say just a couple of things, very quickly in response to that. Three things. The point about the economy and the healthcare concerns being separate. It's morally, it's disgusting to even think of it that way. Economically, it turns out to be not true, even if you were morally depraved enough to want to think of it that way. Those countries, I mean, not just the United States, but Sweden and stuff like that have said, let's just let the pandemic do its thing. it's turned out to have very bad economic effects on them, worse economic effects than on many of the countries that intervened more seriously. And if we look at regions of the United States, it's becoming more clear every minute that those people that said the economy is separate from healthcare, or let the healthcare take care of itself, we need to take care of the economy, it's turning out that their economy is devastated much more than a place that intervened like New York City or something like that. So, I mean, there's just two levels that makes no sense. Number one, it's morally disgusting, but secondly, it's just wrong. It just, if there's widespread sickness going through the population, I mean, they figured that out in the health movement. Victor would know this, in the 1890s in the United States, when they had that massive health movement that was even backed by the capitalist class in the interest of capitalism. To, if all your workers are sick, it's actually not good for the economy. The second thing is on tourism, and what you said, you know, a lot of people point to Cuba and say, oh, Cuba's turned to a one good economy once again. Well, of course, tourism isn't one good anymore. It's diversified since then. But it has to be understood that in the Caribbean, tourism, Cuba actually has a low tourism percentage of its economy in the Caribbean. I mean, certainly all the small islands have higher percentages, but even Dominican Republic is higher. Even Jamaica is higher. Even Mexico, a higher percentage of the GDP comes from tourism in Mexico, the highly diversified third most powerful economy in Latin America, blah, 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 has more tourism in it. So, you know, again, on the narrow economic point of view, tourism is a huge, what's going to happen to tourism is going to be a serious hit on the Cuban economy, but it's got to be a serious hit on the entire third world that depends on tourism, and that is huge. I mean, that's just absolutely huge. And the last thing that I wanted to say is just to underline, you know, I mentioned it several places in my talk how they're going after the embargo. They're going after every country that's trying to contract for services, but and the fact that it's really become extremely serious under Trump, especially in the last year and a quarter, year and a half. I mean, it was already extremely serious, and then they doubled it and tripled it. And so it's some people just shrug their shoulders. Well, there was already a blockade. Well, yes, the blockade was already phenomenally severe, but when it's 3 times more severe, that is tremendously problematic. And if you go, I mean, you have seen the reports. If you start going around and seeing what the United States does case by case, tracking every single good and the components in it and who's bought it and who sold it and interrupting those, and then claiming that anybody who buys and sells with American dollars is committing stuff against the American will because America controls American dollars even though it's the international currency, then it's, so the point just that I want to state there is it is not possible to understand the effects of COVID on the Cuban economy without understanding not only the blockade, but the fact that the blockade is now roughly 3 times as severe as it was a year and a half ago.
Speaking of responsible tourism, how long do you think it will be before Cuba allows tourists from the United States to come, given the level of the pandemic in our country? I mean, even Europe and Canada won't let us in.
Well, good question, Cliff. Now, the point is you have several, I have different points to respond, but remember that you have some fellow American citizens in Florida of Cuban origin saying that America would be safer if they close, I mean, if they cancel flights to Cuba, because 4 months ago, they had the feeling that probably we can be some kind of challenge, you know, because we will not be able to handle the pandemic. Now it's the other way around, and that is a real possibility that when we open the flights, well, first you have to consider, and always related to the embargo, that this administration was cutting down the flights to Cuba that you have flights to several Cuban airports, several cities, and then they left only Havana, and they reduced the amount of even charter flights. That reduction affects mainly Cuban Americans that were traveling to Cuba by large number, 500,000 annually. On top of that, 500,000 Americans going to on the 12 categories of travel to Cuba. As we have done in the past, when we take a decision, is considering all countries. I mean, it's not because of the kind of relationship we have or we don't have with the United States, but I don't have any doubt in my mind that when we open the airports, we have to consider, I mean, our authorities have to consider those places where the pandemic is under control. We have, and those where it is not under control. And also we have to discuss with airlines the conditions under which they have to travel to Cuba. No doubts, information about medical condition, test, or probably test that I'm saying potentially. This is not, we don't have an official decision on that, but no doubt how you trace those visitors and how you scan them, how you put them to pass a test once they are on your soil is something that needs to be considered, but not something different regarding the United States. Is something that we will implement universally to any visitor coming from any country.
We have
I have a question. Yeah, could I ask a question?
Go ahead.
Yeah,
Victor, go ahead.
yes. Given the success of Cuba, especially not only in its basic public health, but also in treating the cases, I wonder to what extent is Cuba's medical success known in, let's say, in the professional medical community around the world, and what are the conditions for, let's say, Cuban discoveries or successes in the treatment becoming known and accepted for application in other countries?
Well, if I may, I mentioned in my presentation that currently we have requests from official requests to companies from those countries, from 80 different countries on Cuban products, biotech products. We have several of the brigades we have sent abroad is precisely to respond, not to deal directly with the sick population, but to educate, if you want, or to train local authorities and local doctors on how to deal with it. And I haven't mentioned, and by the way, I don't have the precise figure with me, but we have arranged several remote conferences, remote talks with foreign authorities in several countries, talking precisely about this, because in many places, authorities and health authorities, they didn't have a clue about how to deal with it. Not only resources, I mean, they were not talking about ventilators or fancy facilities or equipment, no, the knowledge about how to deal with it and the human capacity to do, and how to structure the system to work with it. Then in many cases, I can tell you, at least in those 61 countries when we had experts, at least on those 35 countries and remote, I mean, overseas territories where we have sent doctors, but in places that where we haven't sent any doctor, particularly here in the United States, and you mentioned Canada and other countries, they know very well. I mean, the scientific community is just one community worldwide. The health experts community, they talk to each other on a daily basis. They read what the other guys wrote on a scientific magazine. They know pretty well. No matter how many political barriers or how many embargoes you put in place, people know. No matter how many articles you write on the media about how serious is the condition or whatever of the Cuban doctors abroad, they know. I mean, the scientific community know. In this country, United States, your leading experts on the subject, they know what we are doing in Cuba, how we are doing that, the products that are available. And by the way, when we talk about the meaning and the consequences of the blockade against Cuba, it's affecting the United States as well. Imagine that suddenly you could have access to that knowledge, to that expertise, and to those products. And when I talk about 80 countries and where governments or companies are requesting information, I'm including the United States. As we speak, we have companies in the United States talking to Cuban counterparts to know a little bit more about the Cuban interferon and to talk more about those products, injections that I have mentioned here, as we have been discussing before. I mean, for years, you have had American centers talking about diabetes and Heber-Plot-P and talking about other Cuban products that we use broadly in Cuba, not only for human health, but for animal health as well.
Thank you.
Okay, other questions or comments? Oh, Bob, you had something. Bob, unmute yourself.
Mhm.
Wait a moment, please.
Okay. Was there a question there from the chat box? We have people apparently have trouble getting in the chat box or leaving questions. So we usually don't have very many.
Here he is.
Excuse me, I have two questions
Good.
from Kathy Siegner, and I have one to add of my own. Kathy Siegner asks, how difficult is it to get into medical school in Cuba? In the US, the acceptance rate for 2018 was less than 7%. What is the rate in Cuba, or how easy or difficult is it? Number two, Kathy also asks, if you do not get into medical school, if you're for being a doctor, are there chances of applying for being trained as physician's assistants or nurse practitioners? And I'd like to add a question, which is, how difficult or easy is it for US citizens to be admitted to medical school in Cuba, please?
Yes, okay. If I may, well, how difficult it is. I mentioned we have 32 different schools of medicine in Cuba, from those universities that are just devoted to medicine up to faculties in some provinces and even remote areas in Cuba. I cannot tell you it's just anybody, because you have to have a good performance in college, in secondary school. I mean, you have to have limits, but I mean, the acceptance is very broad. And one basic question for people studying in other countries, you don't have to pay for that. You don't have to come from a wealthy family to study medicine in Cuba. You have to be simply a good student, and then you have a large possibility of attending to one of those schools. Then in terms of, if you're not admitted to study something related as an assistant or nursing, I mentioned at the beginning the large numbers of people that are involved in the nursing sectors, experts and different kind of ontologies. I mean, different specialties related to medicine is very broad. If the person who was asking the question didn't listen to the numbers, in Cuba we have in the health sector 479,623 people involved. At a population of, the labor force in Cuba is 4.5 million people. Then you can imagine 1/10 of the labor force in Cuba is related to health. how easy or difficult it is to people from the United States to study medicine in Cuba. We have a program. I have to say that when ELAM was created back in 1999 by Fidel, a few months afterwards, we received in Cuba a visit from the Congressional Black Caucus. And that time was discussed the possibility of how to bring young people from the United States to study medicine in Cuba. And afterwards, through IFCO, I mean, the organization you know pretty well, IFCO, Pastor for Peace, it was implemented, the program that it lasts until today, through which the more than 200 students very soon it will be 300 people from the United States have come to Cuba to study medicine. Most of them, they come from low-income communities. And the only request, of course, you have to send your personal information, your profile, your marks as a student, and of course, there is a process for that. But at the end, and they don't need to pay for that so far. And at the end, the only request we ask from them is to return to their community of origin. I mean, to serve the people who are underserved in the United States. And all of them, they have returned to the United States to serve those communities. And it will continue to happen in the future. As I said, we have 32 universities or faculties devoted to the education of health or medicine in Cuba, or health-related specialties. We have foreign students from many countries, and if at some point we can normalize our bilateral links in a way that we can continue receiving American students, then several of them could go to those places, and we could expand the presence of American students in our university. We are open to do that. Depends on your authorities. Thank you for your question.
We're running to the end of our time. Are there any last comments that anyone would like to add? I would like to just comment that what we have seen is that Cuba is a medical superpower, unique in the world, and imagine what a better world it would be if a rich country like the United States with great resources adopted similar policies. It would be world transforming. But right now, we just have Cuba as the world medical superpower. Well, thank you so much, Ambassador. We really appreciate your sharing this time with us. And thank Al and Victor as well for their contributions to our discussion. We hope that those of you who have been watching on YouTube have enjoyed today's program and have found it as informative as I have. You should know that all of the Global Justice Center's revenue-raising programs have been canceled due to the coronavirus. Nevertheless, we continue to pay our Mexican staff. So if you can make a tax-deductible donation, please do so at our website. Thanks to Bob Stone, Betsy Bowman, Liz Mestras, Gregory Diamant, Roberto Robles, Colette Mora, and our Mexican administrator, Olivia Canales, for their help in making this and our series of webinars possible. Today's webinar, as well as past programs, are available on YouTube and are accessible from our website. Coming up, we have next week a webinar on racism and identity a very hot topic in the United States these days. We will have presentations by Charles Mills and Linda Alcoff, who have written extensively on questions of racism and identity. That's next Monday at 1 o'clock, same station. We hope that you will join us then. And in future webinars, we have some amazing webinars planned in coming months. We have one on the struggle for global hegemony. We have one on Venezuela. We have a webinar on socialism in the 21st century. I had mentioned Vicente Navarro, who will be on speaking on how the pandemic has shown the private system of funding medical care in the United States is a disaster, and many more. So please join us for those events in coming weeks. And thanks again to our presenters today.
Thank you very much, Cliff.
Thank you, Cliff.
Thanks.
Be well.
Absolutely. Be safe, yes. Thank you.